Hello, I'm Dr. Sindhu, one of reading doctor here today. May I confirm your good name, please? Nice to meet you, Mrs. Alia. May I know what brings you here today? Okay. Tell me more. Okay. I'm very sorry to hear about sad news, Mrs. Alia, and I understand your condition, how difficult situation would be for you. Mrs. Alia, is there anything more you'd like to share? Okay. Right, Mrs. Alia, you need not to be worried. I'm here to try best of our abilities, to support you, okay? And I'll try my best of abilities to answer all your queries if it is clear to you, Mrs. Alia. So, Mrs. Alia, to better understand, I'll ask few questions related to your condition. Is it okay with you? Okay, so Mrs. Alia, may I know what test you have gone through? Mrs. Alia, 44 years. Okay, so mammography, fine needle biopsy, MRI, ultrasound of liver too. Spread of cancer, okay. Bone scan to see spread of cancer. Okay. Then I'll keep all reports in front of me. All right, Mrs. Alia. May I know what medicine you are taking? Okay. Okay, Mrs. Alia. Does these medicines help? Okay, Mrs. Alia. May I know why you can't go to sleep easily? I'm very sorry to hear about that. I understand. It's not easy for you to cope with. Yes, Mrs. Alia. Is there any member of family, like mother or sister, ever had breast cancer? Okay. And Mrs. Alia, what worries you most in particular? Okay. Okay, Mrs. Alia. I have seen the reports, okay, which confirm your breast cancer last stage, and it has spread to your liver and bones, and it is difficult to predict how long a patient will live depending upon the type of cancer or response of medicines. But usually a patient has 2 or 3 months to live after the spread. Can I offer you a glass of water? I'm sorry to give you this serious information, but Mrs. Alia, it was necessary so that you can choose treatment options and make your will as advance directive in the presence of family lawyers, if it makes sense to you, Mrs. Alia. Yes, Mrs. Alia, you need not to be worried. I will help you in all the areas you need help, including somebody to help you at home, like respite services, okay? And there are some NGOs to help you financially and provide food vouchers for you and your child, okay? And help you in preparing your will and adoption of your anything, okay? And needy, okay? And finally, to facilitate your admission to the terminal patient care, what to keep you comfortable and pain-free till end, okay? And we will deal all these issues one by one. How it sounds to you, Mrs. Alia? Is it okay with you? Yes, Mrs. Alia. You are a brave woman. I can arrange some nurse who will, help you when you feel lethargic, and some respite care services to facilitate your daily home course. Okay. Is everything clear till now? Yes, Mrs. Alia, and if you know if you need any help, okay, I will help you to arrange a helping hand in the form of nurse and by care, okay, and your physical, emotional, and spiritual needs will be fulfilled, okay. Yes, Mrs. Alia. Yes, Mrs. Alia, better and strong painkillers like morphine and petidine in form of injection and patches can be given, okay, so that you do not remain in and okay. Yes, Mrs. Alia, and besides that, fentanyl, patches are also available, which are morphine painkiller patches, okay, can be given to relieve pain for 24 hours, okay. Yes. Yes, Mrs. Alia, have I dealt all of your worries and expectations? Is there anything else you want to ask or share with me today? Okay, Mrs. Alia, I would like to see you after every 2 weeks. Is it convenient to you? Yes, Mrs. Alia, if you develop any severe pain or any bleeding from the wound of operation, please seek immediate medical help, okay? And I, as your family physician, will always be there to help and guide you, okay? You can call me anytime, okay? And is there anything else you want to discuss with me? All right, Mrs. Alia, I wish you, healthy life, okay, and take good care of yourself, okay. And you can contact me anytime, okay. And here is a leaflet. It includes all the information regarding your condition. I hope it will be helpful for you, okay. Take care. Bye bye.